in the next 30 minutes, we're actually now going to be talking about living with arthritis. What are you meant to be doing? And Lorna will be of good help here because you have actually been in this situation. And maybe you can just tell us the tools and the resources that you have been having to contain this particular problem.
Okay, first and foremost, I think it's a support from my family.
Yes.
That is from my parents and from my sibling, my brother, where they encourage me a lot when I've forgotten my medicines, take your medicines, or stuff like, have you eaten well? Have you taken your medicines? Have you drunk a lot of water? So it's a support that I get from my family, both from my parents and also from my friends, who keep giving me the hope that, you know, we are there for you and stuff like that, especially during my admissions this year. Because I've had quite a lot of admissions this year, but they've been there with me. So I think the support first. And then another thing is during this weather, I think it's been a very cold weather. Yeah. So also being warm and also ensuring that you are dressed warmly, you're eating a lot of good food like fruits and vegetables to help you, you know, go through this very cold weather, and also to avoid a lot of straining of the joints. That is carrying a lot of loads, walking maybe up the stairs too much or walking too fast. Like I have a tendency of walking too fast. So I'm always being told, no, please walk slowly and stuff like that. Yeah. So I think the support and majorly taking care of myself and ensuring that I'm taking my medicines well and I'm remembering them also. Yeah.
All right. And in terms of exercising, what exactly are you doing?
To avoid a lot of strenuous exercises, like maybe going through the bike exercise or stuff like that. But I go through exercises like walking, a lot of walking. I also go through exercises like I've gone through physiotherapy also. I also do exercises like waking up in the morning and ensuring that I just don't get out of bed. I wake up and, you know, first ensure that the joints are okay by stretching them out and making sure that the hands are straightened up and stuff like that, and ensuring that I do a few exercises of the knees, yeah, to enable me to go on through the day.
Okay.
Yeah.
All right. And Doctor, there's a myth that arthritis cannot be treated. It is only managed. Would you agree with that?
Well, I wouldn't agree with that because there is effective treatment for arthritis. So, as we talked about earlier, is that we have different types of arthritis. But the key thing to treatment of arthritis is that we need to get the patients early. So usually what happens, each time you have inflammation into that joint, you get irreversible joint damage. Yeah. But if you get your patients early, then you can treat and prevent that joint damage. I need to add at this point is that I mentioned about, for example, gout. Now, philosophically now, we are saying that you can cure gout. Gout is as a result of high uric acid. Yeah. So if you don't have high uric acid in your body, then you do not get gout. So you can treat that aspect of that type of arthritis. The inflammatory arthritis, like what Lorna has, the treatment is quite effective. Yeah. The only thing is, as she rightly put, is that when you're on treatment, you need to adhere to your medicine. Yeah. So there are many conditions in this world where you can treat them effectively, but you cannot cure. But you can effectively treat and you don't get the disease, so long as you adhere to your treatment.
Okay.
Yes.
All right. So when does surgery come in?
So surgery has a big role, especially when we catch our patients late, so they have joint damage that is irreversible, where we cannot do what we call conservative treatment. So those patients, they can be offered surgery. Yeah. So there are situations, for example, in osteoarthritis, the knee is quite damaged, the other joints are quite damaged. We used to see, but we are still seeing in this country, for example, sadly, in rheumatoid arthritis, patients coming with very deformed joints, very deformed hands. Yeah. So some of those patients, to be able to make them economically viable or to engage in meaningful activities, at times you can take them through surgery. They get joint replacements and so on.
Okay.
Yes.
Do we have natural ways of treating arthritis?
So in terms of natural ways, I would look at what you talked about, exercise. Exercise is very important in terms of prevention and in terms of management of of the disease.
Okay.
Yeah.
All right.
So exercise is one very key important thing.
Okay.
And our mantra in rheumatology is we want to keep the joints moving.
Yeah.
Yeah.
Keep the joints moving.
Yeah.
And on that note, we have a caller online, Sharon from Isili. Good morning, Sharon. How are you?
Good morning.
How are you?
I'm fine, thank you.
Yes. Do you have a question or a comment?
I have a question.
Yes, please.
I have my mother who is sick.
Okay.
Yes, that's problem. So my question is,
Yeah.
and what about the food which is supposed to eat?
Okay.
Yes.
All right,
Food.
South.
Yeah.
Okay. Okay, Sharon, thank you very much for your question. We shall be answering shortly. Maybe, Doctor, you can take us through now when it comes to food. Are you supposed to change your diet in any way?
So diet has an impact on your general life, general well-being, but it also has an impact on your musculoskeletal health. So musculoskeletal is where your bones, your joints, and so on. So we need to have diets which are rich in calcium, in vitamin D content. Avoid diets which have, especially patients who are predisposed to diseases like gout. Avoid diets which are high in purine content. Yeah. So low intake of your red meats, your seafoods, alcohol.
Yeah.
As I mentioned, cigarette smoking is a very big risk factor
Absolutely, yes.
for rheumatoid arthritis.
Yes.
So one of the things I always tell my patients who are smoking, the first prescription is stop smoking. Yeah?
Yeah.
Yeah. So things like smoking, we need to avoid. But generally, the general guide is that a well-balanced diet will go a long way in improving your musculoskeletal health. Yes.
And you can always consult your nutritionist
Exactly.
just to guide you through what to eat and what
Absolutely.
to avoid. Yeah.
Yes.
Okay.
Yeah.
And one of the most common symptoms that you have told us is the pain, which is constant. How do you manage that pain?
Yeah. So pain management is a very core part in terms of management of patients with arthritis. If patients who have inflammatory arthritis, if you manage the disease, then you sort out the pain, because you shut off that tap of damage to that joint. Yeah. So, for example, Lorna will tell you that she's not on any painkiller right now; she's just on anti-inflammatory drugs. Yeah. So, it is not all your patients who need to be on painkillers. Remember, these painkillers, they come with lots of side effects. One of them is like they can give you ulcers. They can also give you other toxicities. For example, they can damage your kidneys. They can damage your heart. Yeah. So address the primary disease. There are instances where it might not be very possible to have a big impact on the primary disease. For example, in patients who have moderate to severe osteoarthritis. Yeah. So these are patients who will take them into some pain management programs. These could be drug therapies.
Yeah.
Drugs can either be taken orally, they can also either be given into the joints. The other modalities for managing pain.
Okay, just shortly, please, because we have another caller online right now, Duncan from Kisii. Good morning, Duncan. Hello, good morning, Duncan.
Hi, Tracy.
Hi, hi. How are you? It's Sarah for now. How are you? Yes. Do you have a question or a comment? Hello, Duncan. Hello. Hello, Duncan. Okay, apologies for that. I think we lost him, but we shall be getting back to him shortly. And you were explaining how to manage the pain. Yes, please just carry on. Sorry for the interruption.
No, it's okay.
Yeah.
Yeah, so the other modalities for managing pain, for example, physiotherapy. Yeah. So taking your patients through physiotherapy will have a big bearing into reduction of the pain. Yeah. But also we do work hand in hand with the pain specialists. So there is pain that we may not be able to manage. So we refer to the pain specialist and they can,
Okay. What about fatigue?
Yes. So fatigue is one key symptom that patients, especially the ones with inflammatory arthritis, do get. Yeah. So one of the things that you can address in terms of management of fatigue is to treat the primary disease. Yes. But the other thing that really has a bearing on fatigue is exercise. Yeah. So you realize as you exercise, the more you exercise, the better your fatigue will improve. Yeah.
And Lorna, maybe if I can ask you, does the pain occur when the weather changes? Like, for example, when now during this cold weather, is the pain more as compared to when it's hotter?
Yeah, the pain is more. Actually, I was in a lot of pain the night of Tuesday, where I couldn't sleep because of I attributed it to the cold weather. So the pain comes like very severe to moderate, depending on exactly what you have done during the day. When you strain a lot during the day, you tend to have a lot of pain during the night. Yeah, so during the cold weather, I tend to have a lot of pains and a lot of strains, like a lot of numbness, a lot of feeling like because of now the medicine that I'm taking, some of the acidity in the stomach also increases a lot because now the knees have been strained. Yeah, so the weather affects a lot the pains.
Okay.
Yeah.
All right. So, and as Dr. has said, you know, there's a way that we can manage that with time.
Yeah.
But apart from the pains, also arthritis actually does cause a lot of high rates of depression.
Yes.
Why is that so?
So all chronic diseases, what happens with chronic diseases is that you know, there is always that thing of patients get, like Lorna had mentioned, she had to go through a lot for her to get to a diagnosis. Yeah. So there is that desperation that comes into patients, and with that desperation, you get anxious, you get depressed. Yeah. The other thing that we are noticing is that because of the inflammation, there are those mediators of inflammation. They've also been shown to have an increased. They also tend to put you at a higher risk of depression. The other factor that causes depression is pain. Yeah? So generally patients who have pain and pain which tends to be recurrent tend to have higher susceptibility to depression.
All right.
Yes.
And most patients who actually have diabetes are at a risk of getting arthritis, same to the heart disease, right?
So I would put it the reverse. So arthritis, for example, especially the inflammatory arthritis, put you at a higher risk of getting a cardiovascular disease. So we do not know whether diabetes puts you at a high risk of getting arthritis, but we would postulate that diabetes puts you at a higher risk of getting infections. And when you have higher risk of getting infections, then you might get higher risk of getting infectious arthritis.
All right. Yeah. And we have another caller online, Ken from Nairobi. Good morning, Ken. How are you?
Yes.
Hello. Good morning, Ken.
Yes. Good morning.
Yes. Good morning. Do you have a question or a comment?
Do you have a question?
Yes.
Yes. I'm asking for my mom.
Okay. Carry on.
Yeah. My mom usually has pain on the joints.
Okay.
Yeah. Is it the same disease I'm asking for?
Sorry, I didn't get that. Kindly just repeat the question.
What during the day?
Okay.
She usually complains of the pain, not sleeping at night. Hello?
Hello?
I'm saying that when my mom works during the day,
okay,
she usually can't sleep at night because of the pain.
Okay. All right.
Is this the same thing you're talking about?
Okay. Dr. Fred will be answering that. Thank you so much for calling us, Ken.
Okay, thank you.
Is it the same? Like he says that the mom has a lot of pain during the day, and then it goes all the way through the night. Do you think that this might be arthritis?
Yes, so if it is pain in the joints, then it could be arthritis. Yeah, and I think the mom needs to be evaluated.
Okay.
Yes.
All right.
Yeah.
Okay, so let's carry on with the discussion. We were talking about the link between diabetes, heart disease, and kidney to arthritis, and you're trying to explain how those three are connected.
Yes, so I said diabetes in terms of there is increased risk of getting infections in patients with diabetes. So that can put them at a higher risk of getting infectious arthritis. But I also mentioned that arthritis itself can also put you at a high risk of getting heart diseases. So actually, inflammatory arthritis now we are seeing as a cardiovascular disease risk. In terms of ulcers and gut problems, So the arthritis per se would not put you at a high risk of getting your stomach problems, but the medication that is used can also put you at a high risk of getting those stomach problems. Yeah. The medication that is used can also put you at high risk of getting other organ damage, for example, liver problems, kidney problems, and so on. So these patients, when you manage them, you have to follow them up closely and look out for these complications.
Okay.
Yes.
And you earlier mentioned that arthritis can actually have an effect on your skin. How does that happen, and what really does happen to the skin?
So arthritis can either be a primary arthritis, means that you have, it's just a primary disease that usually involves the joints, or it can be a secondary arthritis, so other diseases that manifest with joint problems. So primary arthritis, for example, in rheumatoid arthritis, rarely, but does occur. They can also affect, it can get, remember, this is an inflammatory disease, so there is inflammation. So the inflammation is not only confined to those joints. The inflammation can be confined to other parts of the body. So the skin can get involved in rheumatoid arthritis. So you can get inflammation of the blood vessels, the small blood vessels in the skin, and you get what we call vasculitis. So these are patients who can come with what we call vasculitic rash. There are other types of diseases, for example, in lupus. So lupus is an autoimmune disease which affects basically any part of the body and can present with arthritis. So in a disease like lupus, the patients can present with skin problems. So they can present with some typical rash. You can get some rash in the face. You can get rash all over the body. So the skin can actually be involved in patients who have arthritis.
Okay. So for a mother who's pregnant, do you give them special care when they have arthritis?
Absolutely. So pregnancy is, first of all, I have to say that the inflammatory arthritis tend to be more common in women of the reproductive age. So we're talking about between 15 and 49 years. So your patients will want to desire conception. So there's challenges that come with that because, number one, the drugs that we use, most of the drugs that we use tend to be toxic during pregnancy. So in terms of their desire to get babies, then this has to be a shared decision between the doctor and the patient, because we can switch them to less powerful drugs that they might use during the pregnancy. But the other good thing is that nature is so merciful in that most of the patients who have arthritis, when they are pregnant, then we tend to see that the disease activity tends to get better. Yes.
All right.
So it's a paradox that people don't understand. And you find that they respond to drugs which ordinarily they wouldn't respond to.
They wouldn't, Okay, all right. Okay. So even for someone who has arthritis and they are taking some certain family planning tablets, does that affect it in any way? Or if I have any other disease, the medication that you're going to give me, the tablets that you're going to give me, when I combine it with any other medication, does it slow down the process of managing the disease?
Yes, of course, when you have different drugs that you're taking, and for example, contraception and so on, is that you might get what we call drug-to-drug interaction. So the way drugs interact is complex, is that at times drug A can lower the levels of drug B. So for example, if you have a drug A which is lowering the levels of your contraception, for example, then you're not going to get an effective contraception for that matter. You might also have a drug where probably your contraception medication is lowering the levels of your arthritis medicine. Then you don't effectively treat your arthritis. Okay,
and we have another caller online, Kenneth from Mombasa. Good morning, Kenneth. How are you?
Morning.
How are you?
Habari ya asubuhi.
Mzuri sana, labda yako?
Niko mzima.
Okay, uko na swali ama any comment?
Niko na swali kwa daktari.
Uliza.
Niko na situation.
Hello, yes?
Yes, my situation is, nikuwa nimelala.
Okay.
The first is few steps in the morning.
Okay.
Hapo kwa Stiffness. I feel some pain kama nimetembea kama 5 steps alafu inaisha. Alafu huyo inashika kama inakwama kabisa. Pia kwa makoti.
Okay.
Kuna some sounds when kama nimechuchumaa.
Okay.
Sasa nilikuwa nauliza daktari. What is the problem here? Si kama couch kama ni.
Okay, sawa. Atakujibu shortly. Okay, thank you very much, Kenneth. Interesting question. Sama kwa kisigino, and I think this is the kisigino, if I'm not wrong.
Yes, yeah.
Yeah, and you know, when he's walking, there's so much pain, and also on the knee, there's a lot of pain when he sits, and also when he's, you know, doing any kind of activity. Do you think that is a symptom of arthritis?
So yes, so the pain at the heel can be a symptom to a type of arthritis, which you call spondyloarthropathy. Yeah? So that pain at the heel is a very common thing that we see. We call it plantar fasciitis. So at the heel you have the skin, and underneath, overlying that skin, you have what we call fascia. So because of constant pressure, you get pains. Yeah? And this you see in people who stand for long, people who their work basically is walking and so on. Yeah? Yeah. So that can be a symptom to arthritis. Yeah. So I think the caller needs to be evaluated.
Yeah. Okay.
Yes.
Right. So let's go back to what we were talking about before we picked up the call. And this is the combination of any other medication to now the arthritis medication and how it can actually affect you. And you have said that in some cases it might slow down. Yes. So are there any tablets that we should avoid? But before that, Lorna, maybe you should just tell us whether you have experienced this kind of a thing before, where you've had to combine two different kinds of medication and it has affected you in any way.
Yeah. Once I started my medication for arthritis, I started with the doctor who used to treat me then gave me some medications that were very acidic to the stomach. So they caused me a lot of acidity. So once I saw a doctor, a gastroenterologist, they gave me some drugs. After they gave me those drugs, they started reacting with the drugs that I was taking. So that means that I would get bouts of diarrhea, I would get some nausea and some more joint pains. So there was an interaction between the drug for gastritis and the drug for arthritis. It has also happened this year where there was a problem with my medications that I was taking, where there's a specific medication that was causing me some acidity in the stomach. So that interaction caused me now to move from the oral medication to the injectables, where now I stopped taking them orally to stop them from affecting my stomach, now to taking them through injections. Yeah.
Okay. And if you were to talk to people out there, you know, like family members who have someone who is suffering from arthritis, what would you tell them?
I think I would first start by telling them that they need to support their members who are going through arthritis, because it's a very difficult condition to go through, but it's also a very positive and easy condition also to go through, because if you just take your medications well, if you stay warm, if you take your fruits and vegetables, you're okay. So first they need to support their members, and then next is just to keep, you know, asking them each and every time, what have you taken your medication, what is going on, and if they notice anything that is maybe not going well in their body, to seek help immediately. Like, for example, if you feel a bit of acidity, if maybe you're feeling like maybe your eyes are getting yellow because of maybe you're developing jaundice or something like that, you need to seek help immediately. So the parents or guardians or friends need to support them through that.
Okay. Yeah. Dr. your final thoughts on this one?
So my final thoughts would be, let's be on the lookout for patients who have arthritis. Seek help early, and when you seek help early, we can actually prevent most of this damage and disability that we are seeing increasingly in our country.
Okay.
Yes.
All right.
Yeah.
Okay. Thank you very much for coming through and having this discussion with us. It was very informative. Lorna, asante sana, and we hope that you are going to overcome all this, and we wish you all the best. And Dr. Fred Otieno, thank you so much for coming through and for sharing
Thank you so much.
your knowledge with us.
Thank you.